Imagine this, you walk into a hospital. There's no doctor sitting across from you, no stethoscope, no human face. Instead, a machine scans your body, analyzes your symptoms, and tells you what's wrong. No emotions, no hesitation. Just data. Now ask yourself one honest question. Would you trust it with your life? Today, people keep asking, will robots replace doctors? But that question is actually wrong. The real question is not if doctors will be replaced. It's how medicine itself is changing. And the answer is far more complex and far more interesting than most people realize. This question didn't come from science fiction. It came from reality. Artificial intelligence can now detect cancer from scans, predict heart disease, analyze millions of medical records in seconds. Robotic systems assist in surgeries that require extreme precision. So naturally, people start to wonder, if machines are better at accuracy and speed, why do we need doctors at all? This fear isn't irrational. Every time technology improves, jobs change. History proves this again and again. But medicine is not a factory job. It's not a single task. It's a complex system of decisions, responsibility, and human trust. Most people think a doctor's job is diagnosing illness. That's only part of it. A doctor interprets incomplete information, balances risks and benefits, makes decisions under uncertainty, communicates fear, hope, and reality, takes responsibility when things go wrong. Medicine is not mathematics. There is no perfect equation. Two patients with the same disease can need completely different treatments. And this is where the idea of replacement begins to break down, because machines excel at pattern recognition. Humans excel at judgment. And let's be honest, in some areas AI is already better than doctors. Medical imaging is the strongest example. AI systems can analyze X-rays, MRIs, CT scans. They can detect tiny abnormalities that even experienced doctors might miss. Why? Because AI never gets tired, never loses focus, compares your scan to millions of others instantly. This doesn't make doctors useless, it makes them more powerful. AI acts as a second brain, one that never forgets. But notice something important. AI does not decide treatment. It assists decision-making. When people hear robot doctors, they imagine robots operating independently. That's not how it works. Surgical robots do not think, they do not choose, they do not take responsibility. They are tools. Extremely precise tools. They reduce hand tremors. They allow micro-movements beyond human ability. They increase consistency. But every movement is controlled or approved by a surgeon. If something goes wrong, the robot is not blamed. The surgeon is. That fact alone tells you everything about replacement. Society does not trust machines with ultimate responsibility. Here is where the idea collapses. Medicine is full of uncertainty. Patients lie, symptoms overlap, data is incomplete. AI requires clean inputs. Humans operate in messy reality. A machine cannot understand. Cultural context, emotional distress, family pressure, fear behind symptoms. A doctor can sense when something feels off, even if tests look normal. That intuition is not mystical. It's experience plus empathy. And now consider this. If an AI makes a mistake and a patient dies, who is responsible? The machine, the programmer, the hospital, the company? No clear answer exists. Medicine is not just about accuracy, it's about moral accountability. Doctors swear oaths, they face consequences, they carry emotional weight. A machine cannot feel guilt, it cannot apologize, it cannot stand in front of a grieving family. Until society solves this ethical problem, replacement is impossible. When people are sick, they are vulnerable. They want reassurance. They want honesty. They want someone who understands fear. A robot can simulate empathy, but humans can detect the difference. This is why. Psychiatrists, pediatricians, palliative care doctors are among the least replaceable roles. Medicine is not just about curing, it's about caring, and that distinction matters. So what actually happens next? Not replacement, transformation. Doctors will work with AI, not against it. AI will handle routine diagnostics, reduce errors, speed up analysis. Doctors will make final decisions, handle complex cases, manage ethics and trust. The real shift is this: doctors who refuse technology will struggle. Doctors who master it will dominate. Let's be realistic. High-risk, repetitive diagnostic tasks, administrative medical work, basic screening roles, low-risk surgeons, psychiatrists, complex case specialists, doctors with tech literacy. Medicine will not disappear. It will become more elite. So will robots replace doctors? No, but they will change who deserves to be one. The future doctor will not compete with machines, they will command them. And the most important part of medicine, judgment, ethics, humanity, will remain human.